Good afternoon, everybody. Welcome for the day 2 of our webinar on systematic review and meta-analysis. So day 1 was very fruitful, and I had enough comments, good comments from the
I can't
participants.
hear.
Am I not audible? Am I
Yes, sir,
audible?
you are.
Yes, sir, you're audible, sir.
Yeah,
You
fine.
are audible.
Yes, good. So good comments were there for Dr. Nikhil yesterday. So the session was well appreciated by everyone. The PGs were very happy so that it was explained very well systematically. So they are expecting the same thing ahead. And due to the good response, due to the good comments from others, the response is good today. Probably we'll be having some more who will be adding up with us. And I'm expecting Dr. Vinay and probably Dr. Imam Malini and other staff also to join us today. And for today's session, we have Dr. Romi, who will be speaking on search strategy. So I have Dr. Dharmashri, who is working with me as a professor in our department, who will be introducing her, and we will be moderating the session for today. So over to you, Dharmashri. You can continue.
Good afternoon, everyone. It's a pleasure to meet all of you, all the speakers. And so today it's my pleasure to introduce Dr. Romi Jain. She is the Associate Professor and the Head of the Department from Public Health Dentistry, Prerna Dental College. After completing her BDS from VS Dental College, she completed her post-graduation from Government Dental College, and she already has credit for one registered Prospero systematic review. So, Dr. Romi, please, you can start with your session. And the participants, please hold your questions till the end and refer to me with your questions. Once I give the green signal, you can ask the questions at the end of the session. Welcome, Dr. Romi Jain.
Thank you very much, Dharmshri ma'am. Am I audible to all?
Yeah, you are. You're pretty
Okay,
clear.
fine, because I could not hear your voice, ma'am. That is why.
Okay.
Okay, so first of all, I would like to thank Dr. Neeta Mohanty, Dean, Faculty of Dental Sciences, Ramesh sir, the Department of Public Health Dentistry, and Management of Shiksha Anusandhan for giving us this opportunity, sir. We are honored and privileged. My whole team is very happy to present this webinar with you all. I hope we would do the justice to this topic and we would be able to clear at least some of your doubts by the end of this workshop. Okay?
Yes.
Systematic review is a very vast topic. It's a whole science which we have tried to make it very simple, and we have included some basic steps and divided our session into 6 different sessions of 1 hour each. Okay, so today we are going to discuss about a whole lot of all the steps involved in search strategy. Okay, ma'am, can you make
I'll
me
make you
host?
as a host now. Okay. Yeah, I have done it. Kindly share and go on.
Yeah, sure. Okay, my slides are visible.
Yeah, it's visible.
My slides are visible, sir.
Yeah, it's visible.
Okay, okay, fine. So yesterday, yeah, and sir, am I audible?
Yes, audible too. Yeah,
Okay,
Romi, you're
fine.
audible.
Thank
You
you,
can
sir.
continue. Yeah, please.
Okay. So yesterday we discussed the basic things. Yeah, sure. So Dr. Nikhil discussed in detail about the what is focused question, how do we frame our focused question, what is the PICO model or PICO concept, right? And we discussed about the inclusion and criteria, right? So as Nikhil rightly told that the first step is the most important step in continuing your systematic review, right? The first step is focused question. It is very important to have a well-defined focused question, and rest all steps would depend question. We all have to remember one thing, that systematic review is secondary research, not the primary research. Okay, we are trying to accumulate all the results or all the publications which are available to us regarding some particular topic, right? So it is very important that we accumulate or collect all the articles which are published or which are not published. So we need to collect all the resources from the different search engines or databases or gray literature, etc. So search strategy, we can say this is the heart and soul of your whole systematic review process. Okay, because it needs to be comprehensive, it needs to be explicit, and it needs to be duplicable or reproducible as far as possible. Okay, so let me show you. Okay, so basically search strategy is well thought out plan to search for information. It is an organized structure of key terms which are used to search a database. Search strategy combines the key concept of your search question in order to retrieve accurate results. So basically, after making our inclusion and exclusion criteria, the next step is to find out all the relevant articles which are available, right? So to have all the relevant articles in our hand, we need to form a systematic methodology to go and doing the search. Okay. So let me show you, what are the steps in search strategy. The first and important step, that is formulate a research question. After formulating a research question, we need to identify key concepts from the research question. Okay. Main important concepts we need to identify from our research question. After identifying our research key concepts, we need to frame or develop search terms. Okay, search terms are those terms which we would use to retrieve articles which are relevant to us, right? So it is very important that we develop a relevant search term. Okay, when we talk about search terms, this is broadly classified as free text terms and control vocabulary term. Clear? So what we have done till now, we have identified key concepts, then we will develop a search terms in form of free text terms and control vocabulary terms. Okay. After searching the terms, we would apply search field onto these terms. Okay, it means where exactly we would like to search these terms in the article. Okay. Then we will apply some advanced search filters which are given by different databases. After doing all these things, we are ready to go and narrow down our search by applying Boolean operator. After Boolean operator, we will go for a search limit. Then we will go for a piloting our search strategy. Then we will adapt a search syntax for different databases and the final search strategy. Okay. So let us go one by one. Okay. First thing is to formulate a research question. Okay, we have already discussed yesterday in detail by Dr. Nikhil that our research question should not be too vague or it should not be too specific or should not be too broad, right? It has to be focused research question. Okay, we'll go to the next step. Fine. Now we have to identify our key concepts from the research. And these key concepts we will identify and transfer them to the concept table. I'll show you what is concept table is. Okay, so how to identify or which concepts to be included as our key concepts, right? So what we have to do is, we have discussed yesterday the most practical of identifying the main concept. Identifying the key concepts by looking at our PICO. Okay, means we are looking at our population, our intervention group, our comparison group, or outcome group. Okay, so or it depends on what different types of topics or different types of research question. We might have PECO, that is population exposure comparison and outcome, or only PIO, it can only be a population intervention or outcome, right? So how we are identifying key concept based on our this PICO concept. Okay, so basically we are identifying any main disease we are evaluating, or any condition we are studying around, or any intervention we are looking for a systematic review, or any therapy we are looking for, or any etiology. It could be anything which we are looking for. Okay, this is basically our objectives of doing systematic review. What are the key concepts, and what do you think, what terms should be included to retrieve all the relevant articles? Okay. Okay. So next, I'll show you some examples of identifying key concepts from the research question. Okay. So the first title is anti-plaque efficacy of herbal mouthwashes compared to synthetic mouthwash in patients undergoing orthodontic treatment. Okay. So from this focused question, I would make my concepts like concept number one, population. Population or patients undergoing orthodontic therapy, right? Then second concept could be my intervention group, that is a herbal mouthwashes. The third concept could be my comparative group, that is a synthetic mouthwash. And concept four is anti-plaque efficacy, what we are looking for, right? So these are the four concepts what I have identified from the focused question. Clear? We'll take another example like prevalence and risk factor of dental caries among school-going children from low socioeconomic locality in India, a systematic review. So let me find a main concept from this title. So first concept, I'm looking for a prevalence type of study, right? Prevalence data, right? So I have taken it as a prevalence. The concept two would be my risk factor. I'm looking for a dental caries. Then the main domain of study or focus is our dental caries. So I have included that as a concept 3. The fourth is the population is our school children. So we have included that. And also they have mentioned about the low socioeconomic locality. So we can include that in our concept table. Okay, we can go on add some more relevant concept, like suppose I would like to focus only Indian studies in my systematic review. Okay, so what I will do, I will India or Indian. Okay, so that is how you add on to your concept table. So first we would like to identify the main concepts, okay, from our focused question. Okay, I hope I'm clear till now here. So this is the template to make a concept table. This is very important that we fill up this table before we start searching anything. Okay. So what we will do, what we are doing here is, first we have these concepts in each column. Okay. Then first row is key concept. These are the same key concepts what we will have identified from our focused question. Okay, concept number 1, 2, 3, 4. Okay, then we will move on to our next step, that is identifying the search term. Okay, it can be free text terms we need to search for, and then control vocabulary terms. So let us go to the step number 3, that is defining the search term or developing a search term. Okay, as I already told you, the search term we need to find for our each key concept. Okay, suppose we have selected a concept like green tea, then we have to find the free text terms used for green tea as well as the control vocabulary terms used for a green tea. Okay, so free text terms. What are these free text terms? Basically, these terms can be anything which are used by different authors. Okay, it can be synonym for our concept term, it can be a different spelling variant of our concept term, or it can be some medical language or a layman terminology which is used for our concept term. It can be acronyms, abbreviation, anything, basically any other term which is used in place of our concept term by different authors. Okay, by different authors. Okay, so this is our free text term. Okay, let me show you from where all we can get these free terms, okay, free text terms. So it is very simple. We just need to type our focused question on Google, okay, find out the relevant articles which is available on the Google, okay, open it and look at the title. We can look at the abstract or keywords or even a text words for free text terms. Okay, suppose green tea I am typing and I am looking for different articles which are published in relation to green tea. Okay, and now I will look for what other terminology some author might have used something else instead of green tea. Okay, like green tea extract or polyphenol green tea. So these are the different terms which are used by different people. So we need to identify those free text terms by looking at the similar articles. Okay, another way of doing this is we can look for a similar literature review or a systematic review which is already published. Okay, and we will look for their title, abstract and search terms what they have used. So again, from there we can pick a few terms for as a free text terms in our table. Yeah. The next, we can find out the free text terms from something known as entry term. Okay, entry term is basically related terms which are mentioned in subject heading database. Basically, all the databases, all the bibliographic major databases has their own subject databases, subject heading database. Like most of us must have heard about the mesh terms which is used in PubMed search engine, right? So similarly, we have a different subject terms which are used by different database. Okay, so when we go and look for a subject terms or a medical subject heading, we find something known as an entry term over there. There is a list of terminologies what they give. Okay, so we can even select the free text terms from these entry terms in our concept table. Okay, I will exactly demonstrate you where we find these entry terms, okay, in coming slides. Okay, and definitely we can have a subject expert's opinion in this field. We can ask the subject expert about the any alternative term or commonly used other terms for that particular concept. Okay, or even a Google or dictionary can help, right? So here is an example I have written. Is animal assisted therapy more effective than music therapy in managing aggressive behavior in elderly people? Okay, so what I have done here I have identified first key concept. Okay, like my population is elderly population, my intervention is animal assisted therapy, my concept 3 is music therapy which we are comparing, and concept 4 we are looking for a changes in aggressive behavior, right? So these are my key concepts which I have noted down. Okay, now I have looked for free text term for individual term. Like suppose elderly people. Elderly people, many article may mention about elderly population or geriatric population or old age group or elderly. So these are the different terms which are used by different articles for this particularly population age group. Okay, so we have to search these terminology as many as possible and put it in our concept table. Okay, similarly for animal assisted therapy, when I looked for, I found animal assisted activities or animal therapy, pet therapy, dog therapy. These are the different terminologies which are given in different articles. Okay, so that I have put it in my concept table. Similarly for music therapy, I have got some articles are using music or sing, auditory stimulation, all these things are used by different articles. So that is how we make our concept table. We write first key concept in the table and then we go on and find about free text terms. Okay, there's another example I'm showing you. Comparative evaluation of effect of green tea and chlorhexidine mouthwashes on gingival inflammation. So this is my title of my systematic review. So what are my key concepts? So here I have taken first intervention group is green tea. Second intervention group, comparative group is my chlorhexidine mouthwash. Then we have a gingival inflammation, which we are looking effect on. And since my aim is to include only randomized controlled trials in my systematic review, I have added a study type as a randomized control trial. Okay, so this is how we identify a key concepts from the title. Fine. Now I found out the free text terms for each key concepts. Okay, like green tea, I found green tea extracts, green tea polyphenols. For chlorhexidine, articles are using like chlorhexidine mouthwash, chlorhexidine digluconate, etc., and so on. There are many terms which we have to add on to this table. Okay. Similarly, for gingival inflammation, we have got gingivitis, gum disease, periodontal disease, etc. For randomized control trial, articles use abbreviations sometimes like RCT, sometimes they only mention about the clinical trial. So all these things I have put it in my as a free text terms. Okay. This is another example. We can see comparative evaluation of success rate of calcium silicate based cement and calcium hydroxide in vital pulse therapy, a systematic review. So again, I identified my key concept as a calcium silicate cements, the calcium hydroxide cements, and vital pulse therapy, and go on and adding the free text terms in this concept table. I hope I'm clear till now. Okay. So what we did till now, just a small revision. We first developed our focused question, right? And then from focused question, we identified keywords. Okay. Keywords are a key concepts which we identified, right? Then I entered those key concepts in my concept table. Okay. The template of concept table I showed you, right? Then after identifying or writing the keywords or key concepts, we will find free text terms for each concept. Okay, free text terms are, it can be anything like synonyms or acronyms or different spelling variants or different terminologies which are used by different peoples, which we have to find out. Okay, so how to find out? It is very simple. Go on and look for a similar article. Okay, and we would get a different terminologies used by different authors for that particular concept. Okay, so that is how we find out the free text terms. Fine. We are going to the next step, that is controlled vocabulary term or subject heading. Okay, here again, this is the second category of search terms. Fine. I already told you every bibliographic database has their subject terms database. Okay, these terms are known as the subject terms or index terms or descriptors. Okay, so basically what happens is, suppose we are looking for a chlorhexidine mouthwash. Okay, and some other person also has done a study on a chlorhexidine mouthwash, but he might have used some other terminologies like biguanide. Okay, so in those the index term or search term are basically, these terms are used to describe the content of each articles, okay, which the database is indexing. Okay, so we can find out the different relevant articles even though they are not using the exact term what we are using. Okay, that is why it is very important that we include the controlled vocabulary term or subject heading in our concept table. Okay, so these subject headings differs between the each database. Okay, I'll give you example like these subject headings. If you go and search MEDLINE via PubMed or Ovid, it is known as a mesh terms. Okay, or medical subject headings. Even Cochrane is using mesh terms. Fine. When we are looking for an Embase, the Embase has something known as a M-tree terms. Okay, when we are looking for a Scopus, it has something known as a index terms. Clear? So every database has their different terminologies or different subject heading database. Okay, we need to be aware before we start searching a particular database. Clear?
Yes, we are clear. Good going.
Okay. So now I'll show you the same example I have taken here, comparative evaluation of green tea and chlorhexidine mouthwash on gingival inflammation. So what we had already added key concepts and a free text term into the table, right? Now I have found out the control vocabulary term for these each concept names. Fine. And then I have added here. Like I found for green tea, the mesh terms are poly E green tea extract or camellia sinensis or green tea bioflavonoid. Right. And similarly for chlorhexidine, I got chlorhexidine or biguanide. For gingival inflammation, I got gingivitis, gingival disease, or some articles may include a periodontal disease. Okay, so this is how we go and add our control vocabulary term. Okay,
Yeah,
now
just a
let
minute,
me
Dr. Romi.
demonstrate you exactly.
Yeah, Romi, just a minute. I'll interfere. Somebody, Dr. Priyanka, she has unmuted her speaker. Please mute it. It is disturbing us. Priyanka Brahma. Yeah. Okay, thank you. Yeah, continue, Romi.
Yeah, sir. So, sir, I will now I will demonstrate how exactly go and look for a control vocabulary term. Okay, for all demonstration purpose, sir, I am using only PubMed search engine because this is the most practical and feasible way we can. It is freely available, accessible. So when we type mesh database, this this links opens and this is our mesh database. Okay, so suppose I want to search oral cancer. So I type here oral cancer. My screen is visible, right, sir?
Is visible.
Yes, yes, ma'am.
Yeah. Okay, fine. So see now oral cancer when we type, we got these categories over here: mouth neoplasm or LT01 protein human and all these things. So I think my relevant terminology is mouth neoplasm. So I will click on this mouth neoplasm and the whole web page is open here. See now. Okay. So these are basically our mesh terms, how it opens. I'll tell you how exactly. So they have explained first what is mouth neoplasm. It is a tumor or cancer of mouth. This is our terminology. Okay. After that, there is something called as a subheadings over there. Okay. There are various domains they have mentioned over here, like analysis or anatomy or blood or epidemiology or etiology or anything. Okay. So basically, we can select in which area we would like to search our term. Okay, like suppose I'm looking for some treatment options for mouth neoplasm, so I will go and click on the therapy. Okay, or if I am looking for some radiotherapy option for mouth neoplasm, so I will click on that. So it will narrow down our search. More specific, we are giving the instructions for a searching. Okay, so this is the subheading options. Okay, when we go down here, there is something known as the entry term over here. Okay, these are the list of terminologies what they give. So from these entry term, we can select 2 or 3 terminologies for our free text terms. Clear? So these are the entry terms, like we can select mouth neoplasm or neoplasm comma mouth or oral neoplasm, cancer of mouth, oral cancer. So these are the various terminologies. We can select 2 or 3 or 4. It depends on us what we think, what are the terminologies are relevant and would give us or would retrieve or relevant articles for us. Okay. So these are the entry terms. When we go down here, this is called as a mesh tree. Okay, this is basically they have given the broadest category on the top and the narrowest category below. Okay, and since we had typed oral cancer, the mesh term related to oral cancer is highlighted here as a mouth neoplasm. Okay, so mouth neoplasm, if we further want to specify like gingival neoplasm or leukoplakia or lip neoplasms, so we can go on and click on those terminologies and it will further open another mesh tree and give you the particular term for that concept. Okay, so this is our mesh tree and we have got this terminology over here. Okay, so this is how we select our mesh terms. Okay, this is on PubMed search engine. Okay, so different databases has their own subject heading database. We need to see the options which are available over there. Like suppose I type heart attack. it gives us the terminologies like myocardial infarction, right? Again, they have given the so many subheadings over here. And if we go down, we have entry terms over here. And further moving down, we have this mesh tree here. So we can select the most relevant terminology for us as a mesh terms. Fine. Okay. Fine. So till now, what we have done, we have selected a focused question, then we selected a key concept, then we searched about free text terms, right? And then we added control vocabulary term. So this is how our concept table is almost ready. Fine. So the next step. Okay. Now there is something known as a search field. Fine. Search field is nothing but where exactly we would like to search our concept terms. Okay. Suppose green tea. I want to search a green tea, but in which part of article I would like to search that term green tea. Whether I am looking in the title or whether I am looking in the abstract or whether I am looking for the keywords. These are known as terms. Okay, so various databases gives us the abbreviation of different search terms. If you look for a PubMed, it gives you the option of title, that is you can write it as a TI, abstract, that is AB, then we have a keyword headings, that is KW, or a text word as a TW. Fine. So again, these search field, we need to write it in bracket for our all the free text terms which we have added in the concept table. Clear? I'll show you on the table. See, now when you look for a free text terms, I have added TW here, right? I have added TIAB here. So TW means text word. Text word means anywhere in the article. Okay. Title and abstract. This is TIAB. So I would like to go for searching the chlorhexidine digluconate in a title and abstract. So this is how we can apply the search field for our free text terms. Please remember, we are applying search field only for our free text terms, not for the control vocabulary terms. Fine. Control vocabulary term, automatically the bracket mate would be written as the MH. Clear? So what we have done, we have applied the search field to our free text terms here. Fine. Okay. Next step is apply search options. Okay. Various databases gives a different options for advanced searching. Okay, I have included the most commonly which is available on the PubMed or Embase. Okay, we will discuss about the phrase searching, wildcards and truncations, and proximity operators. Okay, so let us see what is phrase searching. So phrase searching is nothing but we are searching 2 or 3 words as a phrase rather than the individual terminology in the articles. Okay, so suppose example skin cancer. So I have put the skin cancer in the quotation, double quotation mark, right? So double quotation mark is necessary to give the instruction of phrase searching. Okay, so this double quotation mark means the whole term will be searched as a phrase. Okay, article who are having the skin cancer as a phrase will be retrieved if we put that. Okay, similarly heart attack. So here we will be searching, or the search will be made for those articles who are having the heart attack as a single phrase. Okay, not the heart and attack. Clear? So this is the option of phrase searching. Next is the truncations and wildcards. Fine. This is to search for a different variant forms of a single word. Okay. So yeah. So truncation basically allows us to search for a different variant or a different spelling forms of a single stem word. Okay. So there are various symbols which are used for truncations and wildcards. These symbols again vary from one database to another database. Right? If we talk about the PubMed, basically they use asterisk here. Like example I have written here like microbe. Okay. If I put a asterisk, with microbe, it will search microbes, microbiology, microbial, microbacteria. So all these terms automatically will be included in our search. Okay, so this is how our work is easier. So this will search all the different forms of that particular word. Clear? Same with the behavior. So basically behavior, I have put the asterisk in between O and R. It means it will search the different spelling form, whether it is VIOR or VIOUR. Similarly for disruptor or disruptor. Okay, so this is how we use truncations and wildcard. The next is proximity operators or adjacency operators. Okay, basically it gives us the option of how closely we want our search terms to be found in relation to one another. Like suppose I write animal and therapy, in between I have written ADJ1. It means it will search maximum one word in between the animal and therapy. So it will search animal therapy or animal based therapy, animal assisted therapy. So it will allow only one word, up to one word can come in between the animal and therapy. Fine. But PubMed doesn't offer this proximity operator. So anyways, but we need to know all about all the options available. Fine. So same concept table I am showing here again. See, I have put the phrase searching options here. I have put the double quotation marks around the chlorhexidine mouthwash, right? Like gum disease I have put. So I would like to search these both the term as a single phrase. That is why I have put double quotation mark. Fine. You look at here, I have put the asterisk mark over here in the randomize. So it will search both the spelling variant, whether it is a Z or it is a S. Okay, so this is how we go for a advanced searching options. Okay, again we need to remember advanced searching options differ from one database to another database. Fine. So whenever we are making our search strategy, we need to know about the different options available in different databases. Yeah. So now our concept table is ready. Okay, we are moving on to the next step. Fine. The next and very important step is applying the Boolean operator to our search terms. I hope everyone is with me and I am clear to you all.
Yes, yes, Romy, you're clear, going on with good speed. Okay, carry on with the same.
Yeah. So Boolean operators, fine. So basically, what are the Boolean operators? These are or, and not. Fine. So what is and? Basically, if we apply and between the two or three terms for articles to be retrieved, all the terms should be present for that particular article to be included in our search. Fine. Like suppose I have written as aspartame and cancer. So if we add and between aspartame and cancer, so articles would be retrieved only if they have both the terms in their text word or in their abstract. Okay, so this is how we apply and. So basically what we are doing, we are narrowing down our search by applying the and Boolean operator. Clear? Okay. Next is or Boolean operator. Okay, so basically what we are doing here, we are joining 2 or 3 or 4 search terms by applying or. So this would give us an option that any one of the search term, if it is present in the article, article would be retrieved by our search. Clear? So like same example, aspartame or saccharine or sweetener. So all the articles, they are having either aspartame or saccharine or sweetener would be extracted when we are running our search. Fine. So what we are doing here, basically we are broadening our search area by applying or Boolean operator. Clear? And the last one is a not Boolean operator. Basically here we apply not to exclude any record if we want. For example, AIDS not hearing. So here I would like to include all the articles which are using the AIDS word but not hearing word. Okay, so basically we are excluding some records here, fine. But for all the practical reasons, in systematic review when we are going for searching, the not Boolean operator is not used. Okay, it is not recommended to use not Boolean operator, because sometimes we unnecessary we exclude some relevant articles. Fine. So we will be using only and or in our whole search strategy. Okay. So now let me show you how do you apply this and or in our concept table. So what basically you have to do is, first you need to make or run the search for individual search term. Okay, whether it is a key concept or it is a free text terms or it is a control vocabulary term. We need to go and run free all the search for individual term what we have selected and put in the concept table. Okay, after running the individual search, we would join all the terms in a single concept by using or Boolean operator. Okay, so what we are doing, we are broadening our area, like all the terminologies in concept 1 we would join by using or Boolean operator, and finally we would join all the concept all together by using and Boolean operator. Let me show you with the example here. Like this is the same example I'm taking again. So concept number 1 was green tea, right? So I would like to join, first I would like to run my search by using the term green tea. Okay, I will put in the PubMed advanced option. I will show you exactly how it is done. Okay, then I will see how many articles are retrieved. Fine. Then I will put the other terminology green tea extract. Okay, then I will see how many articles are retrieved. Then I will type green tea polyphenols. Then I will see how many are retrieved. Similarly, I will go and search for all the search terms which we have added for a concept. Clear? After doing individual search, I would apply or between different terms which are present. Like I would run as a green tea or green tea extract or green tea polyphenol or poly E green tea extract or camellia sinensis. So I have applied my or Boolean operator in between all the search terms for a particular concept. Okay, so what we are doing, we want all the articles to be retrieved who are using either of these terms, right? So that is why I have applied or Boolean operator for a single concept. Clear? Similarly, I would do this for concept 2, concept 3, concept 4. Fine. And after applying this, I will join all the concept 1, 2, 3 and 4 by applying and Boolean operator. Clear? See, I'll show you. See, same thing I have written here. Like I would like to join or put a Boolean operator or between the different terminologies of concept 1, like chlorhexidine or chlorhexidine mouthwash or chlorhexidine digluconate or chlorhexidine or biguanides or mouthwash. So I have join them with the or Boolean operator, and then finally I would join all the concept by using and, because finally we would like to see all the concept in one article, right? So we are narrowing down our search by applying and Boolean operator. So this is how we run our search. Fine. After doing these searches, whenever we go for some online shopping or any online the platform, they have options of filtering, right? Filters you can apply based on the gender or based on the items you need and all those things. Similarly, each database has the option of filters. Okay, so when you see the PubMed, on the left hand side you will see the column where all the filters are available. Like you can limit the database based on the publication year or publication type, or whether it is available as a full text or only abstract is available. So all different filters are available which we need to finally apply and define or more refine our search. After doing making all this plan, we will pilot run our strategy. Fine. We would see how many articles are getting retrieved by using each individual terms. Okay. Sometimes it happens that we put some terminology and we get zero result. It means that term is not at all useful for us. We need to exclude that from the concept table. Sometimes it happens that one term is giving a lot of results. So again, that is unnecessary, right? So again, we need to pilot run this strategy. We need to see what are the important terms, finally what in our concept table. Clear? So again, like how we have a different guidelines to check the different modalities of different types of studies, right? Similarly, to know whether we are going in a right direction in our search strategy, there are various guidelines available. Okay, the one of the guideline I've taken here is as a press guidelines, which is easily available, free PDF on the Google. There is a list of options which you need to tick one by one whether we have done it in a systematic manner or not. So this will give you the overall picture how we have a consort guidelines or Prisma guidelines. Similarly, we have this guideline for our search strategy. So we can look for this guideline and see whether we are going or whether we are missing some step or not, right? Okay. Now, after doing all these things, this what we have done is for one type of database. Fine. Ideally, we need to go and search 2 or 3 different databases. Fine. And I already told you different databases has some differences in them. So we need to find a different syntax for a different databases. Okay. Very simple example. If we talk about the control vocabulary terms, this differ from one database to another database. Like mesh term, when we search a mesh terms for dementia, it gives us the answer as Alzheimer disease. Okay, where when we go for a CINAHL heading for a CINAHL database, it gives us a option of Alzheimer's disease. So there are some variations from each database. So we need to find out the different variants. Okay, same thing for search field, same thing for advanced searching options. So we need to find out those and make our concept table for different databases. Fine. And then finally, we will go for a final search strategy. Clear? So let me exactly demonstrate you how do we go about the searching on internet. I will go for a PubMed advanced search option. So my screen is visible.
Yeah, it's visible.
So what I have opened here is a PubMed advanced search option.
No.
Basically,
No,
when you
now
upgrade it,
no, it is only
PPT
the
is
PPT is visible now.
okay, PPT, fine.
Yeah. Earlier, your advanced
Now?
option had come. No. Yeah, now the advanced option is there.
Okay, fine. So this is how the advanced PubMed search web page opens and looks like. Okay. So what they have done recently, they have upgraded whole system here. Previously, it was a different preface of it. Okay, fine. So what we need to do here is, first step, we had a focused question. Then we identified key concept, right? For each key concept, we had search free text terms. For each search term, we will run our search. Okay, I'll show you exactly how. So I will put the first term as a green tea. Okay, then here is the option of adding it. I have added in query box and then search. Fine. This will give us the answers like 33,299 articles are retrieved by using only the term green tea, right? When we again click on this advanced option and go down, there is a history and search detail option comes. Okay, this is the most important part of it. Okay, when we click on the search green tea, or how exactly PubMed has used this term for a searching, right? It has split it into the two, like tea as a mesh term, or tea on the all fields, or green in the all fields, green and tea and green tea. So what I was talking about search field and advanced search option, the PubMed automatically puts all this advanced search option into the terms and search it. It is known as a ATM processing in the PubMed search engine, that is automated term mapping processing. So we don't have to take tension about applying the search field and advanced search option for a PubMed search engine. Fine. So our things are easy. So this was for the first term which I have taken from our table. Okay. Now next term I will take it from our table is green tea extracts. So again click on, and now I got 7,612 result by putting this term, right? I will put another term for the green tea polyphenol. So now I retrieved 5,107 result by using the green tea polyphenols, right? Now next we will go on look for a Camellia sinensis. So now I got 3,754. So when I click here advanced, so my screen is visible, right? Sir?
Yes, it's visible.
Okay, fine. So you look for a search history over here. It will give you the results. Like green tea, when I used, how many articles got retrieved? For green tea extract, 7,600. For green tea polyphenols, 5,100. Right? For Camellia sinensis, 3,754. So this is how we need to go on searching for an individual search term, what we have put in our concept table. So this was only concept number 1, right? Now what I will do, I will add all these terminologies by OR Boolean operator, right? So what you need to do, you can see the option of action over here. Just click on here, add to query box. Okay, go into the second search. You will get an option of whether you want to add it with an and or, right? So I would go for a Boolean operator or. Similarly, I will add on to the polyphenols with or, and then Camellia sinensis with or. Okay, and I will click here. See here. So query box has all the 4 terminologies, and I will go and search now. Okay, so finally I got 33,586 results. It means what? All the articles which are having either green tea or green tea extract or green tea polyphenols or Camellia sinensis would be retrieved by my search strategy. Okay, so I will put it again on advanced search options here. Go to the history part, and if you click here, this gives you the whole detail of searching. Okay, this is very important because you need to reproduce this document as it is when you are making your manuscript for a systematic review. Okay, so there is an option of downloading here. You can see here downloading. So when you click here, this whole history would be downloaded in an Excel sheet with all the details. So we don't have to manually sit and make our search strategy. Okay, it is automatically done. So this is how we go for a first step. Now let me put it for the second concept. Okay, so I will put it as a chlorhexidine. I will search. So I got 12,300 result for the chlorhexidine. Then I will go for another terminology, chlorhexidine mouthwash. Okay. So I got 8,728 results with chlorhexidine mouthwash. I will go for a chlorhexidine diguanate. I got 3,217 results. Then I would be using, sorry. It's 27,849 result I got. So we'll go to the advanced option again. Okay. So this is our concept 2, right? So I have included biguanide, chlorhexidine digluconate, chlorhexidine mouthwash, or chlorhexidine. So I will just add on to the query box, join them with the or, Okay. Look for the query box here. Check for any irregularities or we have missed something here. Then search. So I got finally 31,667 results. Means all the articles are retrieved with either chlorhexidine term or chlorhexidine mouthwash terms or chlorhexidine digluconate terms. Fine. Now I will go and look for a gingival inflammation. So for gingival inflammation term, I got 17,700 results. Then I would look for gingivitis. So I got 57,700 results. Then I would look for gum disease. $33,166 results. And I'll take gingival disease. Let us check in history details. So here, these are the 4 terms we have used, and these are the search results what we have got. Now we will join them by using, add to query box. Since it is a single concept, we will join them by using or Boolean operator. Okay. And now run a search. Finally, we have got 61,382 results. Okay. So what we have done, we have run the search by using or Boolean operator for individual concepts. Now all these 3 concepts should be joined together by using and Boolean operator. Okay. So I will put this, see, now here this is the final concept number 1. So I will add this to query box. Then I will add this with chlorhexidine with and, okay, and gingival inflammation. Right? So this will retrieve, see, this is our search strategy. So this will retrieve articles using all the 3 terminologies, green tea and different word variants, okay, chlorhexidine and different word forms what we have included, and gingival inflammation in any form, gingivitis or gum disease or gingival diseases. So run a search over here. So we are getting finally 20 articles here. See, right? So these are the articles which are somewhere related to our search strategy. Fine. So this is for a demonstration purpose. I have used only 3 words. We can go on adding. Suppose we want only randomized control trial, or we want to add some other terminologies like evaluation of or comparison of. So we can add on to that our concept table, find out the different terminologies for that particular concept, and go and run our search. Fine. So this is how we search. So we can look for a final search over here. See the details. So this is the whole page showing the details, how different terminologies are added by using and or. So this is very important. Now this whole search strategy, after running all the searches, we have to just click here on the download. Okay. And this Excel sheet would be downloaded here. Yeah, so you can see here. Yeah. Okay, I'll share it. I guess you all are not able to see this. Can you all see the Excel sheet?
As of now, we are not able to.
Okay, okay, sir. Now can you see?
No? Yeah, now it's okay. Yeah, we can see.
Yeah, so this is how the Excel sheet is retrieved. Okay, it is downloaded. It has all the history, what was our query and how this is our main search. I'll just broaden this. See, the whole search is here. If you click on this, this will give you all the details here. See the chlorhexidine, all those things. So this is very important, sir, because as we say that your search has to be reproducible. The whole systematic review process has to be such that it can be replicated, right? So all these details are exactly we need to notify it, and we need to give this detail while we are making a manuscript, fine. So this detail, it has the details of all the terminology, all the search strategy, then the time when we have done the searches and all those things. So this is important that we go and have this Excel sheet with us. Okay, so now I will again go to the PubMed page. Yeah. So I will click on the 20 articles. So now I said about the limiting the search, okay, refining our search. So see on the left side, there are options of filters. Okay, the first filter, if you see, this is a timeline what they have given here. So here they have shown the articles from 1997 to 2020. Okay, suppose we want to take only from some particular year, say 2009. So it will automatically omit all the articles if you select this timeline. Okay, so only 15 results are now shown because of the timeline, right? So that is how we can go on putting the uh, filters over here. Just a second. Yeah, so again, there are different types of filters, sir, like abstract or full text or free full text we can select, right? Or article type we can select, publication date we can select. There are some additional filters also. If we click, there is a list, any language, any gender, any subject, any journal we want, right? So this is finally refining our search, okay? I would suggest before you go and run your search strategy, don't apply any search filters. Otherwise, sometimes we may miss some relevant articles over here. So that is why we need to run our search first and then go on and applying the search filters. Okay, so I hope I was clear about the search strategy and it has cleared some of your doubts about it, how to go about it. Okay, so finally what we need to do after running the search strategy, it is very important that we need to document each and everything. Okay, even we need to document what type of filter we applied, which date we searched, what database we searched. Definitely I will give you details of all these things later on. Okay. We have to download and or copy paste a search strategy from the database. Okay, different database has different options. I showed you the PubMed where you have an option of downloading the search history, right? So that is how you go for a search strategy. So this is how we go and do and formulate our search strategy. I would like to again brief you in a stepwise manner. What we did first was formulate a focused question, right? Then after focused question, we identified a key concept from that particular focused question. Okay. After identifying key concepts, we will add on to our free text terms. Okay. These terms are different terminologies used by different people. Okay. After adding the different free text terms, we have applied here the search fields and advanced search options over here. Then we went to the mesh database and searched for a controlled vocabulary terms, right? Then we applied Boolean operator. So Boolean operator, first we run all the individual searches. Like I will use a green tea. I used a green tea extract as a single word or term, and then we made a search, right? After searching individual terminologies, we will add them by using Boolean operator. So individual terms in a single concept would be added by using OR Boolean operator. Okay. Similarly, we would do for all the concepts, and finally we would put a and between the different concepts. Okay. And this will give you the whole search strategy. Clear? So I guess we should stop here. I have finished the search strategy, different steps involved in the search strategy, and tomorrow we will discuss about the different documentations, data synthesis, data extractions, and how to make a Prisma flow charts and all other things. Okay. So thank you very much. Thank you very much for patience hearing. I know it looks very lengthy process. It looks very complicated process, but trust me, it is not. Okay. We just need to be need to have a framework in our mind. We just need to remember the steps, main steps, and go and do it on various databases. Yeah? Thank you so much.
Thanks a lot, Dr. Romy. It was very informative. So now I'll ask the participants if any of them have any questions.
Good afternoon, ma'am. Thank you so much.
Yeah.
This is very informative. Hello.
Yeah, we
Yeah.
can
Hello.
hear
Thank
you.
you. Thank you, ma'am.
I hear you.
Go
Ma'am, how to save these, whatever we'll search and we'll get, how to save this article? Like we taught before about the Jotero app and all. So
Yeah.
this is very confusing exactly.
Yeah, actually, see, whatever I have showed you till now, we have got all the abstracts till now. Okay.
Yes,
Next
ma'am.
step would be we need to find out all relevant abstracts among these searched articles. Then, whatever relevant articles I mean, whatever relevant abstract we have finalized, we will go and find out the full text article. Okay. After searching the full text article, we have various software which manages the data. Okay, sometimes what happens in a systematic review of like a prevalence studies or some observational studies or qualitative analysis, we have large amount of articles which gets retrieved. Okay, so it is very difficult to manually go and do the scanning of each article. Okay, so there are various software which are available like EndNote software, or I will be discussing all those things in a brief tomorrow's
Okay,
session.
ma'am.
Okay, so those softwares would be helpful in managing and segregating the data.
Okay, thank you, ma'am. Ma'am, another question, that is, what is proximity operator?
Yeah. So I told you like animal therapy. Okay. So proximity operator basically tells how closely you want your two terms to be searched. Okay. Like suppose animal and therapy, I put one in between, ADJ1. Okay. That means it would search maximum up to one word between animal and therapy. So animal assisted therapy or based therapy or animal therapy. So it gives you exactly how closely you want your search terms to be present. Okay, so this is how you apply your proximity operator.
Thank you, ma'am. Thank you.
Anybody else? Yeah, Dharmashri, there is one question in the chat. Can you read out? Okay, in the slide about Boolean, okay, Romy, somebody is asking in the slide about Boolean operators, in the examples you have used a mark after cancer, that is atris. Can you please let us know why it is required?
Yeah. So basically, ma'am, I'm using the same example to explain you the whole search process. So when I explained about applying the advanced search option, asterisk mark is basically to find out about the truncations or wildcard. Means any other word, different variant of that particular word. That is why the asterisk mark was there. But I already told you in PubMed, everything is automated. There is an automatic term mapping process which goes on, so you don't have to apply these things while you do searching on a PubMed search engine.
Okay. Marilyn, please
Any
mute
other
your
questions?
Marilyn, please mute your speaker.
Yes.
Yeah, other questions? Any others?
Good afternoon, sir. Vinay here.
Yeah, Dr. Vinay, welcome.
Uh, Good afternoon, Romy. Good to hear after
Hi,
so many
Dr.
days.
How are you? Yeah, good to see you.
Glad that you talk the same way that you used to do in your UG days, and really
Oh,
enthusiastic
thank you so
presentation,
much,
I should
sir.
say. The
All
thing
your
which
students, sir, your guidance.
no, nothing like that. I see a lot of things I have learned from you today, for sure. I was not very keen on saving the search results. It was a very good point. You showed me how to download the Excel sheet, and that helps us a lot because tomorrow we tend to forget how we have done the search and what is the exact booleans which we have used and the keywords which we used. So it is a very good point. I am looking forward the software use which you just told that we can use to apply when we get so many search articles. Okay, so
Yes.
I'm definitely looking forward. Even PGs are there in the session, so definitely they are also getting benefit from this. Thanks a lot. Thank you a lot for Dr. Ramesh sir, your team. Very great initiative, giving young budding talents an opportunity to showcase their skills.
Obviously, yeah.
So a great
Pri-
initiative.
Primarily, I welcome you for joining us. And obviously, see, we feel happy our own students are excelling. We feel proud about that. We need to encourage, isn't it? See, we were learning differently. Our modalities were different. Now these people are into different era wherein they are on
Yes,
their own
one
modality.
positive thing COVID has given us is that we are now connecting with so many, friends of us we have long missed or long forgotten.
Yeah,
Romy, I think it's been like during our internship, maybe sometime way back in 2006 or 2007, is what I remember.
Yes, 2007.
So, so it is such a great time to connect with some friends of us. So one positive that COVID has given us,
yeah.
it's made the world smaller.
It's how we
Yes,
utilize that.
indeed, it's true, sir. We are glad to meet all of you, our fraternity, and present something in front of our people.
Okay.
Okay.
In between, there
I
is one
think,
question.
yeah, there is one question which says, where can we not where can we use the not Boolean
Not
operator?
Boolean operator. Yeah. So, ma'am, when we are looking for any other research, primary research, when we are doing and looking for a similar article, so that time we can use not Boolean operator. Particularly, I said don't use not because in systematic review we want as many as relevant articles to be retrieved, right? So that is where it is becomes thoda sa that it's better we avoid using not Boolean operator.
Okay. Thank you. Any other questions? Yeah, Dr. Romy, I have a question from my side. So
Yes,
this
ma'am.
process is very, very easy when we use the PubMed, right?
Yes.
We can convert the search, the entire search is backed up in Excel, so everything becomes very easy. Is it the same if we do not have many PubMed index articles regarding the particular topic that we have chosen for the systematic review?
Ma'am, actually, I would be giving you the brief idea what all databases we need to search, okay, tomorrow. So what happens is
Okay.
when we look for a standard, the what we say journals or which describes how to go about systematic review, they say you have to look for a standard bibliographic database such as Cochrane or Embase or Medline. Okay, so when we look for these three databases, Cochrane again it is nothing is free over there, but it is very systematic if you look at the website. Okay, it is even easier than the PubMed. They have a lot of other options also, which automatically comes there, and you can easily save everything over there, ma'am. Same for Embase also, but only thing is they require a subscription to access them.
Okay. What about Scopus or
Oh
Google
yes,
Scholar?
ma'am. Scopus
If
also it requires a subscription.
Okay. No, even if we have a subscription, can we save the the search strategy that we used, how it was very clear in PubMed?
Yes, ma'am.
We can have
Ma'am,
the
most of the databases has option of download. Most of the databases have option of downloading, or even if they don't have, we just have to copy and paste it in Excel sheet. That is the other option what I have seen in the other database.
okay. If will you be covering the other databases? Can you just show us at least one more database tomorrow, if you can?
Okay, okay. I will try to show you about the Cochrane tomorrow. Okay, and
Okay.
definitely.
Okay. Thank you.
Good afternoon, Ramesh sir. Kunal here.
Yeah, Kunal, please go ahead. How are you?
Sir, I'm good, sir. How are you, sir?
Yeah, I'm
So
fine.
I had a similar follow-up question, like ma'am had just asked regarding different databases that we are using. How to integrate the searches amongst these various databases? Would you be covering that in the coming sessions? Because that's something which is a little difficult to do.
So that's what there are various software. Some are freely available, some are not. Okay, and where we can all the retrieved articles from different databases automatically goes into that software, and automatically it gets segregated based on the years, or there are various options which we can apply and segregate the articles.
Okay. Thank you, ma'am. Thank you, sir. It's a very interesting and informative presentation and a very interesting topic
Yeah, we
that
look
you have
forward that
selected.
you join in further also sessions.
Yes, sir, surely. We'll do that.
Okay.
And do involve us when you conduct yours.
Yeah,
Let it
definitely.
be a let
Right.
it be a healthy exchange of knowledge.
I think this is Dharmashri, ma'am, right?
Yeah.
Yeah,
Yeah, yeah.
definitely, ma'am. Definitely.
Okay.
Okay.
Any more questions? Good, Romy. Good initiative that you are
Sir, I
trying.
can't.
Yeah. Tell me. Go ahead.
Sir, I can't hear you actually.
Yeah. No more questions, I believe. We'll try to end off.
No. Yes, sir.
Yeah.
No more
Fine.
questions.
Yeah, Dr. Romi, good initiative that you will be trying to get us with some other databases tomorrow. Give your best. Okay. I do understand the limitations. It all depends on the financial aspects also to procure these databases, which are highly priced and all. Okay, but it also depends on some university setups which they can provide, we can utilize. So it depends on which colleges we are working to. That is a privilege we will be having. So we will see that. And personally, I appreciate you. Your presentation was excellent. And as said by Dr. Nikhil,
Thank you, sir.
yeah, he had said yesterday that it will be a good session, and you have justified that, and hope to continue. And I also see,
Thank you so much, sir. Thank you.
yeah, and also I see some comments from some other participants that it was a great session and all. Good to hear these things because, yeah, you young dentists are doing well. Keep it up. Okay, so see you tomorrow at 2 o'clock.
Yeah,
Yeah, right.
yeah, sir.
Okay,
Thank
really.
you.
Thank you.
Thank you,
Bye.
thank you, Dr. Nikhil and Dr.
Bye,
Vaibhav.
everyone. Thank you so much.
Thank you so much, sir.
Yeah, Dr. Vaibhav. Bye. Thank you. Bye.
Right, sir. Right. Have a good day, sir.
Thank you. Wish you all the same.
Thank you, sir. Bye, sir.
Good day, sir. Bye.